Two topics: booty bumping and different types of booty juice is what we'll be discussing in this video. Please like and subscribe. Let's jump right on into it. So you might be asking me why I'm doing a video about these two topics, but the reality is, right now in the psych setting, there has been a lot more rectal meth use or booty bumping happening. And a lot of organizations actually recognize booty bumping as being actually the least dangerous of ways of using meth compared to shooting it or even smoking it, but there can be comparisons with that. But it's become more popular for that reason, but that does not always, let me just tell you, for example, in the psych setting, we're just in, like, what I've seen is, you know, a lot of this is leading to people coming in a lot more paranoid. They're on a crash, they're craving it, and it essentially will make them sometimes where we have no choice but to give them, which leads into the second topic, booty juice. So one thing that's been on the rise is people booty bumping or plugging meth, and there have been a lot more negative outcomes of people coming in more psychotic, or even, you know, having a bout of just psychosis. And what I mean by psychosis, like drug-induced psychosis. So my reason of this video is, now let's talk about booty juice, because recently, as I said, there's been a lot more booty bumping, rectal drug use, rectal drug use, and as well, there has been just more meth use being used. And a lot of times now, I believe it could be laced, some of this stuff. I mean, a lot of times it probably is, because a lot of people are getting it for cheap. And remember, Independence is, for example, like Independence, Missouri, is like I think they've been like one of the top 10 of meth use throughout the United States for like at least 10 years. At one point they were in the top 5, but anyway. One thing I've noticed a lot of, and I made a real quick list of them right here, just real quick, because this video came to me, the types of booty juice that are typically given. And this is for meth use, people coming in, and specifically, let's not even just say meth, but drug-induced psychosis. So, booty juice, what does that mean? And once again, working in the psych setting, we don't use that word. Obviously, we cannot. It's a slang term that has come about. I actually find it somewhat disgusting when people say it, because, you know, that could, you know, what if for whatever reason you used something or something happened and you had to get a shot? It's just the wording. I don't like the word booty juice, but it's used. The first shot is a B52. In my opinion, as an RN, that's the most clutch shot to give, because a lot of times patients coming in, number one, Ativan in it, which is 2 milligrams. Ativan is very, very good because you have a lower chance of having some sort of allergic reaction. Ativan, a lot of people don't have allergies to it. I've run into a few, but all in all, Ativan, a lot of people don't have an allergy to it, or patients don't. And also, the big thing is, you can push so much Ativan and there's not a high chance of like overdose. When people have seizures, epileptic seizures, they sometimes will even have to give patients up to 12 milligrams of Ativan to push it to get the seizure to stop. So Ativan. So Benadryl, Haldol, and Ativan. It is good, in my opinion, because if a patient specifically is agitated and they have not slept in days, because a lot of these patients coming in drug-induced psychosis have not slept in days. What they need is sleep. That's the first aspect. Ativan and Benadryl together work amazing. They will, pretty much within 5 to 10 minutes of giving the IM, they will be relaxing and go to sleep. Now, one instance I will say with a B52 or Benadryl, Haldol, and Ativan is if you have a patient who's gotten it multiple times, over and over and over again, there can be tolerance issues that happen. So when that happens, typically the next shot I've seen them move to is not a Zyprexa IM, surprisingly, in the psych setting. Because Zyprexa, a lot of times, the IM version of it at least, it can help with some agitation, but a lot of times they do not sleep right away. I've seen Zyprexa given, I've given it myself, I've given all these IMs I'm talking about. But if a patient is truthfully agitated and you need, or like they need sleep, it's not the first choice. But anyway, if they have a high tolerance to a B52, the second choice, typically when I call a doctor and ask, would probably be a Geodon IM. Now, a Geodon IM, you got to remember, the key word is it will help with agitation. And if they've had a B52, even if they have a tolerance, if they've gotten that and then they add Geodon on top of it, Geodon will help them sleep, stabilize the mood, which that's the big thing. The good thing about Geodon is it's not just an IM. It can be that that you use it as. It has a great pill form as well. I've seen it really help patients who have schizophrenia. They are in not a high acute state of psychosis, but like pleasantly psychotic, starting them on Geodon. Because remember, IMs are not something that you just give to give. As a nurse, one thing I'll say is you never give an IM injection because you're having, first off, a bad day, and on top of it, just because you think your patient's going to be annoying. There's other ways to go about it. I'll just say that. And I've seen it, but you know, my opinion, once again, IMs are not something you just give out to give out. So Geodon will really help in that situation. Geodon also, as I said, it has a pill form. It works very well, especially patients with schizophrenia, as I said, some psychosis. And next, what I would say is that right there, after 30 minutes of them getting both of those, or they've had the B52 first, and you waited, it didn't work to give them Geodon, so it's been like a total of like 30 to 45 minutes. It will help them sleep. Now, the final one is Thorazine. Thorazine is not commonly given today in most psychiatric settings. Reason being, first, it's used for a psychotic episode again. And I know these sound very similar, I get it, but a lot of times, they can be having, these kind of symptoms. One doctor will really want to use one shot, another doctor will want another shot. So it really just depends, and that's why I'm mentioning all 4 of these shots for drug-induced psychosis. So there are a lot more side effects from this as well. And if you give someone Thorazine, first off, it does put them to sleep right away. Not right away, but pretty quickly. Within 10 to 15 minutes, they're pretty much out. They sleep a long time. It really can cause, I've seen it when they wake up, they have really bad memory issues, which can actually cause in itself psychosis. So like, let's say, for example, you got a Thorazine IM of booty juice because you were in drug-induced psychosis, right? Let's say they tried a B52, that didn't work, or they just went straight to a Thorazine injection. Okay, besides using that bad drug that night before that, you were functioning, you're an adult. You take the bad drug that night, do some meth, and then the next time you wake up probably a day and a half, 2 days later, and what I've seen is their memory is gone. And I mean, I'm serious. Like, Thorazine is something that, depending on the brain chemistry, and this is why I think it's something that the only reason I would even consider it a shot given to a nurse to give, or a nurse getting an order for a doctor for it, and the doctor saying, yeah, give this. The only reason I would see that is like if this was a situation where, let's say they didn't have any other shots on hand, like for example in prisons, this is given a lot. You hear the Thorazine shuffle. Or where a patient is extremely agitated, you give them a B52, you've given them a Geodon 1, and they're still just fighting it. You can't get them to calm down. And even that point, I would still be hesitant, but if they're like, let's say you give them, some people have this rebound psychosis where they get both these shots, you think they're going to be going out, and they get up and they like have this extreme anger. which I've seen, and very violent, that's when you give Thorazine. So yes, so but for just drug-induced psychosis, let's say drug-induced psychosis, they're not agitated, I would not give Thorazine. I'd give a B52. Or if I was a nurse, that's what the doctor would give me. I wouldn't just give it, obviously, then I'd have to get an order. But outside of that, I will say it is used for acute psych episodes, as stating, but it's something that, even as an RN, if I don't feel comfortable giving it, I'll be honest, and I haven't actually run into this situation in the 5-ish years I've worked in psych. I've never said to a I've never gotten an order from a doctor and said, no, I'm not going to give it yet. I have given Thorazine before, but there were a couple situations where we'd given other IMs, as I stated, and they just didn't do anything. And the other one was when this patient came in, they were a frequent patient. They already have a tolerance to B52s. We already know they're allergic to Geodon. Remember, Haldols sometimes can be another thing that patients are allergic to, cause EPS. But also Zyprexa a lot of times doesn't work. It causes really bad lockjaw as well. So, you know, in my opinion, that would be a time. That was the time that we gave Thorazine. So I had two times when we gave it. But outside of that, I really just wanted to do this video because, once again, I'm doing this because I'm trying to relate it to just my daily life and what I've seen in my past. A lot of people have been coming in with drug-induced psychosis, meth, big one, booty bumping, plugging meth, very dangerous, common, and then a lot of shots, IMs. We've had, I've had to administered in the past, and just talking about the different types of shots. And once again, as I told you, I don't like the word booty juice. I'm just saying it because that's how a lot of times that's what people say, and I've heard it, and just please don't say that. It's something that it's immature too. But yeah, I do not condone that. Also, I will be doing a video coming up about some other IMs I've given, a couple other IMs. And also I will be doing a video about just my update where I am with running. But get ready, and in the next one about IMs will be specifically about Invega Sustenna, and Abilify injections and why they are given. Also, like and subscribe. That video drops soon, and then my update on running, which I'm still doing every day. I'm on day 74 of running. But I love you all. Please like and subscribe. This is your daily dose of mental health with Adam. Love you all.